and welcome back to the DIA 2014 50th Annual Meeting in sunny San Diego, California, as the DIA continues to celebrate the past and invent the future. And the future looks very bright. During the DIA 2014 50th Annual Meeting, we will bring you highlights and a sample of the amazing content, ideas, and breakthroughs being exchanged at the DIA Annual Meeting. On Monday, we heard some encouraging words from Jamie Haywood, Barbara Lopez-Kuntz, Frida Lewis-Hall, and Sandy Queter, and celebrated DIA's 50th anniversary in the exhibit hall.
I think we all always need to learn. We're lucky that for this meeting, we're able to offer formal continuing education credits. So that's great for our professional backgrounds, but equally as important is that the sessions themselves are directly relevant to the kinds of work we do and the work we have before us in the next 50 years.
Well, it's a movement called the Walking Gallery, and what we are focused on is getting the patient story front and center at medical conferences like this one. See, people wear business suits and they tend to be wearing uniforms basically at a conference. So what if we took that business suit and put a sacred painting of their life and why they care so deeply about medicine on their back, they went into a room like this and it changes the conversation.
Tuesday was all down to business of learning, collaborating, and networking with over 7,000 life sciences professionals from around the globe.
I think our world has changed dramatically since DIA was founded in 1964. And even in the last 5 years, our world has changed dramatically. Drug development, discovery, life cycle management, the rules are all different now. Everything is global, and DIA has certainly kept up with and in many ways led that trend. I think that's very important, but we also are looking at new tools for regulatory science that didn't exist even a few years ago.
DIA brings global regulators to share their knowledge at the DIA Annual Meeting.
Regulation is a global issue, a global challenge, I would say, and US and Europe still are in the lead, even if Asia is coming very soon and very intensively. I think US and Europe should cooperate more, even more than what they're trying to do now.
Technology was a focal point with Eric David and 3D printing revolutionizing drug discovery and tissue regeneration.
So on the drug discovery side, 3D printing and bioprinting specifically is creating new tissues that are more predictive models of what actually happens in human beings. So bridging the gap between animal models and 2D cell culture on the one hand, neither of which is terribly predictive, and clinical trials on the other hand. So giving you an actual opportunity to test on real functional human tissue before putting drugs into humans.
Organs on a chip. Daniel Kraft, who was the 2013 49th Annual Meeting keynote chair, returned to speak on the topic. Keith Murphy, CEO at Organovo, spoke about being a pioneer in bioprinting technology and what we can expect to see in the future.
So we take cells and make them into tissues, living tissues, using a 3D printing apparatus. One of the first things we're doing is actually making 3D liver that's useful in a drug toxicology testing. Well, I think it's a strong goal to think about making more of these organs all at once and putting them into a situation where they can actually have fluids flowing between them and start to simulate the whole body. Today what we're doing is going organ by organ and trying to say, can we reproduce that to the level where it's better than an animal model and can be used in drug discovery efforts.
With so many options to collaborate and share information, we cannot forget the exhibit floor itself. Amazing. This is only a very small sample of the sessions and forums offered at the DIA 2014 50th Annual Meeting. Don't miss out on next year's annual meeting in Washington, D.C. Mark it on your calendar, and we'll see you there. That's all for today from San Diego. See you tomorrow morning with more exciting discoveries, innovations, and advancements coming out of the DIA's annual meeting.